So, as I mentioned earlier in the introduction, my special guest today is Nurse Melinda Goodwin. Nurse Melinda, how are you doing today, young lady?
I'm doing great. How are you, Michael?
I'm just doing great. I'm so glad to have you back on the show. I announced earlier that you've been on the show before, but I wanted to have you back because not only are you a great guest, but you have got this amazing event for 2026 that you're kicking off the first of the year called 2026, the Year of the Woman. And you're also going to be doing an Embrace Womanhood podcast to kind of keep us all, well, not me, because I'm not a woman you'd want to embrace, but to keep everybody who has a double X chromosome, they can embrace their own womanhood. Um,
Yes,
and I know you're going to be covering, this is a 12-month program, isn't it?
it is a 12-month program. I'm so excited about it. It's been in the works in my head for about 13 years now, but finally it's ready to launch, and I think it is way overdue, but I'm super excited about it.
Well, I'm too. So tell me, 13 years, what's been going on for 13 years? Because I know you've been really busy doing the other podcasts that we're working on, but why did it take so long? Were you just like hanging out?
Well, part of it is I wanted to know what the message really was. I had the idea of it, but I wanted to make sure when we're ready for the message was clear. And it's interesting because with all of the new talk in the medical industry, hormone replacement therapy, and how we have really neglected women's health, that women are not a byproduct of men or horses or pigs or cows. And we're finally realizing that women are, I think, to be honest with you, I think in the world of medicine, a lot of doctors and a lot of schools considered women difficult to figure out, and so they just it's like a room that's full of stuff and you have to clean it and you just don't know where to start, so let's just ignore it. And I think that this year is the year you're going to see a lot of women speakers coming out and speaking about women's health, and I think it's just right timing.
I think so too. I think this is great. Give us a little bit more on your background. I know that you are a certified family nurse practitioner. And what does that mean for folks that don't know what all those initials mean?
So I've been a nurse since 1997, which is a very long time. I've worked in all facets of the acute care. So I've worked medical surgical, ER, ICU, NICU, labor and delivery, OR, did pharmacy, did night supervisor. So I've had a lot of experience in the acute super sick care, and went into doing aesthetics, which is Botox, lip filler, cheek filler, just to have everybody look younger, and realized that through that, there wasn't a lot of people in the industry, even still, who do hormone replacement therapy. So for
Oh,
the last 2 years, I've been specializing in hormone replacement therapy and working mainly with compound pharmacies and doing an organic bioidentical hormone replacement with estrogen and testosterone and progesterone. And then with men, we do primarily testosterone and helping women manage that. As the years have gone by, I have a lot of women that come in and they say, "Why didn't anybody teach me this? Why didn't I know this? How do I teach my kids this?" And so that's kind of one of the reasons why the Embrace Womanhood really got traction over the last 2 years. And I've been listening to them, trying to hear what they are lacking in education or afraid to ask. Because a lot of times we are afraid to ask because we're, oh, that's just normal. Oh, that's just normal. I'm not sleeping and I feel like I'm going crazy. Well, here's your antidepressant. Now go home.
yeah.
And that's really not it. That's not it at all.
So didn't you also get some additional certifications pertaining to stem cells
I do.
and
Yeah.
peptides? Tell us about that. And then I
Yeah.
want to hear about your big invitation and speech in Washington, D.C., but start with the other one.
I know. So yeah, we're so busy. I can't
Yeah.
certified. I took Joy Kong's class on how to administer stem cells. I've been doing that for the last couple of years for different clinics in town and throughout the United States, specifically one out of Texas. They fly in to Las Vegas or St. George and come to our clinic, and we infuse them or give them injections. But even though the FDA has not approved stem cell therapy as a drug, and we can't claim that it cures or treats, we know the components of stem cells and we know how they work, especially if they are umbilical placental cells. And so we're utilizing those in helping our patients who have chronic pain or who have autoimmune, or, to be honest with you, who are 60, 70, 80. A lot of our community here, they play pickleball, they play softball, they play basketball. And so we have a lot of older athletes who just want to continue being healthy and wanting their joints to work. And so we do, like today, I just did a lady, I injected both her knees, her thumbs, and her shoulder, just because she's like, I just want to feel good. And I think that that is the best component of stem cells right now in our industry, and how we can best market it, because it is not FDA approved. And we we have to educate our patients on why you would want to get the cells from the United States versus going out of the country, and how the United States is coming forward in the medical industry with stem cells, peptides, exosomes, all the goods for that. So, yeah.
Yeah. I was talking to a guy the other day, and we were talking about the importance of making sure you get your stem cells from a US based reliable source, and not from overseas from some Asian based company.
Yes. Yes.
He was saying, some of these, and sometimes they will label them, product of USA. And it's really not. They come in these little, he says, they come in a little vial of white powder. He goes, I don't know what the heck this stuff is. It's mislabeled. And he goes, you need to be careful when you're ordering these things. Just make
Yes.
sure you order them from a reliable source.
Yes, especially your peptides too, because a lot of people are getting peptides on Amazon, which is okay, I guess. But I, as a provider, I want to source my where they come from, right? And
Yeah.
so I've been on tour to several labs. I've seen the labs. I've been able to physically be in there with the owners, with the lab technicians, because we are also, we have salespeople. It's the same with any drug that, drug rep that comes in. You have to really make sure the source you're getting is a reliable source. And I think that that's a big thing that's important to separate us from other countries, is because, I mean, Mexico has great medicine, and they have the ability to go outside of the FDA to develop new things that we can come back and learn and provide, right? So I don't want to like discount Mexico altogether, but there are some things like in Mexico, they pay their mamas, they pay them to donate their placental and
Oh,
umbilical cords. And so they don't have the control over that, because how do I best explain it so I don't like discredit, right? But you just don't know what you're getting. We're in the United States, it's donation only, and we test the mom, then we test the placenta and the cord, and it quarantines. There's a different process, so that we make sure what we give to you is great product versus, are we getting sheep cells? Are we getting shark cells? Are we getting multiple generation cell? And that means that you take the cells out of the cord and the placenta, and you take one cell, and then you grow it in a petri dish, and then you take one cell and grow it in a petri dish, and you take another cell and grow it in a petri dish. And 5, 10, 16 generations later, you're getting those cells, which are less expensive but not as good quality as straight from the placenta and umbilical cord, which is what the United States requires.
wow. So you mentioned that you might end up with a shark cell. Did I
Yes.
hear you correctly?
Yes. Yeah.
Tell me about that. That's wild.
They use shark cells for cartilage. Yeah, so at the molecular level, according to some of this research in Mexico has given, is at the molecular level, it's similar to a human, and so they use it to rebuild cartilage. Sometimes they use it for ligament repair. But I don't know. Every time I think of that, I think of Shark Boy and Lava Girl. And I'm like, are we creating a Shark Boy and Lava Girl situation here where generations down the line, what's going to happen if we continue to use those cells? And maybe they're amazing, but it's all education and it's all feeling confident with the product you're giving. And I don't feel confident in that. I would rather stay in the United States with a lab that I've personally seen and experienced with people who are highly intelligent, that's what they do. And so, yeah.
Wow. So, speaking of sharks, I know that sharks have the ability to grow their teeth when they fall out or get lost.
Yes.
So, do you think maybe I could get some shark cells to regrow a tooth that fell so I don't have to go to the dentist?
Do you know there is dental stem cells right now that they are discovering that will regrow teeth?
No way.
Yeah.
Really?
Yeah.
Well, I'm canceling my dental appointment right now.
I'm telling you, it is the wave of the future, right? And as we go and as we learn together, there's going to be so many more opportunities. It's just let's do it the right way.
Do you have the ability to get those shark teeth stem cells, or are they not ready yet?
They're not ready here. I mean, you can go to Mexico and get them, I'm sure.
I'll wait. I'll do it with you. It'll be worth the wait. Tell me a little bit more about peptides. Help us understand what a peptide is, what it does, and why we need some.
Right. So in our bodies, we produce the peptides. They're short chain amino acids. A lot of times it's inflammation. They help with decreasing inflammation. They help with pain. They help with other aspects of neurological functioning. There's so many peptides, right? They're short chain amino acids. And as we grow older, we have less and less ability to produce our own and to produce. I mean, even in the same with the stem cell conversation, we have less and less ability to regenerate new healthy tissue as we are abusive to our bodies, right? And if we have long-term chronic issues, a lot of the autoimmune we're finding is inflammatory response in certain organs or in certain processes like chronic fatigue syndrome and things like that is inflammation of the muscle. So if we can help boost our ability to have extra peptides, these short chain amino acids, then we can decrease the inflammatory response and have a better outcome. Now, can we cure our body eventually? We don't quite know. And again, peptides are not FDA approved. They are on a lot of the professional athlete performance enhancement lists because we know they work so well, right? And that is the important thing to know where you're sourcing your peptides from too, because China's bringing a lot over. You can buy them on Amazon, which I just highly would hope you don't. But so find a reputable provider that offers them. They are prescription. Um, Even though you can buy them, your best option is to do prescription. But the United States now, the compound pharmacies that are registered are able to do some of them, like BPC 157. Some of them can do TB 500. But again, you just really need to make sure the provider that you're working with sources them correctly.
Okay. So now I have another question. It's about with stem cells and peptides, because I know of my extensive education about stem cells, mainly because I've been hanging out with you. Uh, I know that stem cells, they kind of have a mind of their own. So if I have a problem with my knee and I go to get a stem cell and inject it in my knee, it may not actually go to my knee because they seek out and fix whatever's wrong in the body first. They kind of have a mind of their own. I may be going, I need you to go fix my knee. And they go, no, no, no. Something else needs better attention over here. So do peptides work the same way? Or can I inject them into a certain spot and they're just going to go where I want them to go?
Yes. Okay. So that's kind of a little bit of a longer explanation and it's not so simple, right? So when you're looking at different ways you can inject peptides and stem cells, you can inject peptides in the joint and you can inject stem cells into a joint. So let's say you have problems with your right knee, right? We can inject peptides and stem cells in those joints. The issue is the synovial fluid in the joint doesn't really like extra things in there. And they're both components of stem cells and peptides is anti-inflammatory. So when you inject in the joint, it will be pushed out to the outer edges. Now, stem cells themselves are very intelligent and they will go through the body and sometimes migrate outside of that joint and go other areas where your body is requesting, is signaling, is what it's called. They're signaling for repair and then they'll home in on that and they'll release exosomes in there. So if your knee is signaling for repair, then yeah, you're going to get a lot of stuff from that right there, but you also have the opportunity for it to maybe migrate out and search other areas of repair.
Wow.
To do an IM injection in the muscle, the best time to inject a muscle is during a muscle injury. If you have an acute muscle injury, you can do peptides and you can do stem cells in the muscle, and those stay in that muscle for quite a long time and will repair acute injury quite well. If we do stem cells IV. The peptides are not. They're sub-Q, interocular, or interarticular, or IM intermuscle, right? But if you do stem cells IV, you're doing them IV to fix your knee, right? You have to have a reason why you're doing IV and why you choose it to do IV. The stem cells love blood. That's where they live. That's where they grow. That's where they are happier. And so when your body signals for repair and sends those signals in the home, when you're doing an IV, if you have something else that needs to be um, have exosomes for repair, then the opportunity for those cells to go somewhere else and home in and repair and release exosomes for that repair is there as well. So there's different ways we do therapy in our clinic to allow the cells to find the knee. We'll do stem wave or shockwave therapy over the knee, and that way it causes an inflammatory response at that space. And then we do the IV infusion so that it's already inflamed, and so those cells, theoretically will go to the knee and release their exosomes. So there's just different ways you can do therapies to make sure that you're concentrating those cells in the areas that you want to have repair. But some people do the cells just to have cells. They do it for general wellness. I want them IV because I want them to go wherever they need to go and release the exosomes for repair, or they have systemic inflammation, a lot of rheumatoid arthritis. We know rheumatoid arthritis is in every joint. And so they'll have stems for rheumatoid arthritis. And the main component for those is for anti-inflammatory.
Wow. This is all really exciting and complicated stuff. I'm glad you know all these things. And if I have a problem, I'm just going to call you. Hey, can you fix this for me? I think that is so exciting. The things that we're able to accomplish nowadays with modern medicine. Let's talk a little bit more about 2026, the year of the woman, and the Embrace Womanhood podcast. First, let's talk about the year of the woman. Tell me about this whole 12-month event campaign thing you've got going on.
Yeah, so the year of the woman, because women are so difficult, right? I just figured let's just do 12, let's do a whole year. There's just so many things that we want to help, right? So like each year, each month has a theme. So January is like renewal and foundation. So the renewal and foundation is kind of we're talking about hormones, we're talking about a healthy diet, and we're talking about finances to make sure that you're financially healthy. And then we're also talking about meditation, how to just calm the mind. So I have 4 presenters each month at each event. And those presenters are allowed to speak about their businesses, but they also have a topic that they're speaking on. And each presentation is going to be about 30 minutes. And then at the end, we're going to do an activity. So at the end of this one in January, we're going to be doing a dream board or a vision board, whatever you want to call it. I call it a dream board. People call it vision boards. But we're going to do something similar like that. So people have a vision for what they want during the year. And then in February, we're talking about heart health. We will be talking about cholesterol. And, so each month has their own category and different presenters. And then at the end in October, we're going to do a venue booth for the day with all our presenters. We'll have their booths there so you can learn more about them, become friends with them, learn about their products that they sell. And then I'm going to have a VIP dinner and a big presenter at the end. So you can buy tickets for the VIP dinner, but if you attend every month, our event, if you attend all 10 of them, then you get the VIP dinner for free. If you attend 7 of them, then you get the dinner for free, but not a VIP portion of it. And yeah, and then we're just going to have a great big celebration in the following month of November. Just to reiterate, let's do this all again. December then is wrapping up and learning how to let go.
So as the guy, the key word I heard was dinner.
Now, as the guy, you should be attending because women are confusing. And I think this will help men too understand why their women are going. I call it, age 35 to 65 is when your progesterone decreases and your estrogen wanes to a zero. And I call that 10, 15 years the shit zone. And so, we need to know why our women are think they're going crazy. Why are they so difficult? Why are they crying all the time? Why are they hot all the time one minute and then cold the next? I think it's important for our men to be at this event just as much as it is for women.
Well, I don't know if women are difficult. I know I tried asking my wife that question, why are you so difficult? And immediately I got the look, you know the look that you guys have. I got the look that means I am not difficult. You just need you need to go away now and
You
don't.
need to just give me my space.
Yes, you need to go away. Don't try to fix me. It's time for you to leave. Don't ask me any more questions. So I've learned that part. I get the look. Why are you being so difficult? Okay, I got to
I
go
know
now.
that look. I can give it. Yeah.
It, it's terrifying. I know when the kids were little, um, Linda would give them the look, and they all learned. Oh, and we used to train them. Listen, you need to do these things, or Linda is going to give you the look. And they go, oh God, no, we don't want the look. So they learned it wasn't difficult. They just learned the look. You
Yep.
need to stop what you're doing and do whatever she says.
Yes. Amen.
that's that was kind of it. So that's how I've learned to embrace womanhood. They give me the look. Okay, I
You
know.
embrace the look. That's
Yeah,
what you did.
embrace the look. I know what that means. There's no more further discussion needed once we do that. So I see you've got a lot of different topics that you're covering here. February is heart health and love. March is stress, sleep, and serenity. Oh, I need that one. Can I sneak in the back?
Yes. Yes, you can.
Oh my gosh. And you've got some people on here I know with January. Esther McIntyre. I know her. She's
Yep.
really good.
She is
Eight, yeah, she's good. April, hormone. I almost said hormone harmony. Um, foods that balance hormones. Oh, that's a good one. I've talked to a lot of medical people that say, listen, you can fix a lot of these things yourself just with proper diet. And
Yes. Yep.
I think I think that's really good. Oh, so also in April, we have Great Sex with Carrie Ann Humphreys.
Yes.
So I think I need to attend that one too, so I know what you guys are doing.
To tell you, like, as a man and a woman, like, you deserve to have great sex till the very, very end. If you're 80, 90, you know what I'm saying? So keep your bodies healthy and so you can. Absolutely.
I think that's amazing. Let's see. May is anxiety and depression. Oh, overcoming. Oh, Troy Graff is going to be there. I know him too. He's a good guy. June, movement and strength, preventing injury and building mobility. Oh, that's a very important one. That and spinal alignment. Are you going to have like a chiropractor guy, or I don't
Yeah,
see?
I'm planning on having both an energy healer and a chiropractor, and then have Esta come back because Esta's biggest thing isn't nutrition. Like she knows nutrition, but her big thing is functioning, like
Yeah.
for people over 50. So yeah.
Women's skin health. Oh, and July is women's skin health across the decades. Oh, daily rituals for radiant skin. Okay, you need to get my wife to talk at that because she
Part of
seems
it
to
is
be.
why I don't have makeup on is because I did exosome microneedling and it's in its peel stage.
Oh, that's okay. I won't look. Okay. Oh wait, we're on video too. So, let's see. August is fertility, pregnancy, and beyond. Who's oh, Maria? Is it Giles?
Gil,
Giles? Gills?
Giles, yep, Maria
Um,
Giles.
let's see. September, financial empowerment for women. Oh, I think every woman is going to be at that one. That's a good one. Tax strategies. Bob Coleman. Who's Bob Coleman?
Bob Coleman is this amazing financial advisor. He has a new book coming out, and I'm so excited for it. He is locally in town, but he speaks nationally, and he is a really, really intelligent guy on how to preserve your finances and then how to protect them and have them make money for you while you're basically sleeping.
Where is this event going to be held? We've only got a couple of minutes left
Yep.
here. I'll make
So
sure.
Integrated Healing Center is a mental health facility here in town. They have a great big yoga studio on their upper floor. We're going to be hosting each event there until October, and then we're looking for an event center that will host, an entire day's event in and out of
Okay.
people coming in.
So when you say in town, I want you guys who are not in Utah, that's in St. George, Utah. What's it
Yes.
called again? Integrated Healing
Integrated Healing Center.
Center, and that's in St. George, Utah. And if they want more information, they want to buy tickets, I'll bet they can contact you, can't they?
They can, or they can, yeah, look it up on Eventbrite too, because we have that as Embrace Womanhood on Eventbrite.
Okay. So on Eventbrite, look for a Embrace Womanhood 2026, the Year of the Woman. Well, Linda, give us your contact information really quick in case somebody wants to get a hold of you.
So I'm at Finish First Medical. My phone number is 435-500-6734. And you can look at us up at www.finishfirstmedical.com.
Perfect. Melinda, thank you so much for being my guest today. As always, a joy and a delight. And I will see you guys again next time with another exciting adventure in the world of how to make it easy for people to give you money. You guys take care. Oh, and by the way, you guys, if you need a transcript of the show, you can feel free to email me, Michael at 121network.com. That's Michael at the number one, the word TO, the number one again, network.com. Michael at 121network.com. I'll make sure you get any information that you need, a copy of the transcript of the show. If you missed Melinda's contact information, I'll make sure you get that too. You guys take care. Melinda, thank you so much. I'll see you again soon.
Thank you, Michael. I appreciate your time.
Thank you. Bye-bye.
Bye-bye.